I take. Please take a seat. Good morning, everyone, and welcome back for the third and last day of Arctic Circle Forum in Nuuk. As you can see, the next panel is ready for the first session of this day, but a quick overview over this day is that we're going to have this session, and after that we will go in and have some coffee, come back, and there will be a report from a task force from shipping and ports, and after that we will have a session with looking ahead. That is the final program for this main hall. And when we have had lunch, we will move on to the university where there is a side event program. And that side event program, the key word is innovation. So please just be aware of that there will be shuttles outside Radioa to take you to the university after the lunch. But now I would like to introduce the next session's moderator. That is Tina Evalsen, and she's a health consultant in the Department of Health in the government of Greenland, and she will present the panel. The floor is yours.
Hello, my name is Tina Evalsen. I'm the moderator for this panel. This session will discuss the physiological and psychological health of Arctic peoples in the context of economic and social change. Speakers will address topics such as following: threats from environmental contaminants, suicide crisis, lifestyle changes, community and cultural well-being. How can issues such as these be best addressed politically, institutionally, and privately to ensure well-being of the people of the Arctic as the region undergoes economic development? I am pleased to present the speakers in this panel. First speaker, Chair Doris Jakobsen, Minister of Health and Nordic Cooperation, Government of Greenland. Second speaker is Monica L. Ganayuk, Minister of Health, Minister responsible for suicide prevention. She's also Minister of Economic Development and Transportation and the Deputy Premier of the Government of Nunavut. And third, we have Gert Mulvad, who is a physician for the past 30 years here in Greenland. And finally, we have Paul Mathiasson, CEO in the National University of Iceland, Landspítali, Iceland. Welcome. And the first speaker, Chair Doris Jakobsen.
Welcome to session Health and Mental Well-being in the Arctic. Over the past few days, we have talked a lot about economy, natural resources, and infrastructure. These are certainly important topics. Personally, I am happy to have this opportunity to speak at this session, which is about the most important resource we have in the Arctic, the people. In Greenland, we have a public health program called Nunaata. It was started in 2013 and runs until 2019. The vision of the program is all citizens of Greenland shall have the best opportunities to have a good and long life. We have come some of the way, but there is still a long way to go. We are very aware the improvement of public health requires cooperation across the sectors, and that we politicians have a special responsibility to ensure that the overall framework and living conditions allows people to live a good and healthy life. In Greenland, we live in areas in 10 years less than people in the Nordic countries. One of the things that drove our areas in expectancy down is the numerous suicides, with approximately 50 suicides a year. We have one of the world's highest suicide rates. Many of us here in Greenland have experienced suicide at close hand, either among a family or friends. My interest in politics started when I was a young schoolgirl in my hometown, Ilulissat. Back then, there were many suicides. I became a member of the student council at my school, where we succeeded in establishing and counseling for children and young people who had problems. The causes of suicide are complex, but we know that an upbringing affected by alcoholism and abuse increase the risk of suicide. Greenland has a national strategy for suicide prevention. The strategy focuses on structural, citizen-oriented, and patient-oriented prevention initiatives. But it does so because we recognize the necessity of establishing a common approach to suicide prevention across the sectors in order to reduce the number of suicide attempts and suicides. At the same time, it is important to work actively to promote mental well-being among children and adolescents. An example of a project focusing on mental well-being is our Resilience program, which the Department of Health has started in collaboration with the University of Greenland. The aim of this program is to give pupils cognitive tools in order to enable them to deal with the challenges and difficulties that they encounter in life, so they don't turn to suicide as a last resort. Just as we can let ourselves be inspired and learn from the resilience in those who are doing well despite tough conditions. We are also working to ensure that there is access to courses and education in suicide prevention locally, in order to strengthen knowledge and action readiness in the population. This year we launched an interdisciplinary collaboration with Kommuneqarfeqsermersooq concerning the East Greenland town Tasiilaq, which is particularly affected by social problems. East Greenland is also the part of Greenland where the suicide rate is highest. Some of the main questions we ask ourselves when we work together to improve public health here in Greenland are: how can we work together to prevent the widespread abuse of alcohol and cannabis, which destroys families and are one of the reasons why we have so many suicides? How can we break the negative social inheritance so the children can have a better life? What do we do well, and what do we need to do more of? These are also questions which I hope we can address in the session where we will talk about possible solutions and learn from each other. With these words, I give the floor to the next speaker, Roena.
Doris Roena. And the next speaker is Monica L. Kanayuk.
Hola, good morning. Thank you very much for this opportunity to address this concern that we all have. And good morning to Minister Jacobson, Dr. Molad, Dr. Matheson, distinguished delegates, ladies and gentlemen. It is a privilege to be here to address this forum. Today, I would like to address a topic that is fundamental to all our people: health and mental well-being in the Arctic. Our history with modern-day healthcare is interesting. It hasn't always been a seamless connection between modern health and holistic approaches practiced by Inuit. In Nunavut, we are continuously looking at ways for modern healthcare and Inuit practice to be better integrated. We know that physical, psychological, and social aspects are uniquely connected. Our health indicators show we still have a lot of work to do in moving our people forward and providing the supports to make healthy choices and live healthier lives. We are taking steps in this direction in many fronts, especially with the ending of the cycle of suicide. This is an unfortunate issue and a harsh reality that many of us in Nunavut have experienced in some way or another. Our territory has seen an increase in suicide in the last 3 decades. The rates of suicide are 10 times the Canadian national average. But we also know that suicide has not always been an issue historically, and we are doing everything possible to address the current crisis. We are moving forward with new determination to make suicide a thing of our past. In October last year, our Premier, Peter Taptuna, declared suicide a crisis in Nunavut. We created the new portfolio of minister responsible for suicide prevention, of which I lead. Our government created a new quality of life secretariat to oversee the implementation of our suicide prevention strategy. That strategy was introduced in 2010 and followed 2 years of community and stakeholder consultations. We have trained more than 2,000 people to be interveners. We have child and youth outreach workers, mental health workers, and psychiatric nurses in many of our Nunavut communities. We now have 2 mental health facilities. In March of this year, we added another 22 positions across the territory, bringing our budget to a total of $24 million. We are seeing a higher proportion of Nunavut Mute report a strong sense of belonging to their local community. This key strength is fundamental to our public health efforts. It fits with the Inuit definition of health, which relies on the psychological, physical, and social well-being of individuals in a system of strong communities. We must also recognize that the prevention of suicide does not solely lay with the government or a department. It requires partnership, collaborative initiatives, and involvement of all our stakeholders, communities, and individuals to see real change. We are reflecting those principles in our work with our partners, Nunavutungavik Incorporated, led by their president, Kathy Tautungi, the Royal Canadian Mountain Police, and the Embrace Life Council. A one-year action plan called Resiliency Within has been created. The action plan guides us to this fiscal year, while we continue to engage stakeholders in developing a longer-term plan. We are employing Inuktitut counseling by way of a mobile trauma response team and via a toll-free telephone line. This service, provided in partnership with Ilisaksivik, a community-based wellness center, utilizes their counselors trained in Western and Inuit healing skills and knowledge. We hosted recently a stakeholder summit on suicide prevention, which is integral to seeing our long-term action plan. The summit opened the conversation about more good work taking place in our communities. The Akvet Wellness Center introduced a Young Hunters program after school, which looks at food security, mental wellness, transmission of traditional knowledge, and intergenerational connectedness. It received positive interest from our youth. In Hall Beach, another example, a men's group was started to help men stay out of jail cells with regular counseling and healing with elders. Men and their relationships with their families are improving and healing. These examples demonstrate the strength of the individual and community initiatives that serve the core for mental wellness, resiliency, and suicide prevention. They also serve as a reminder that the most effective programs and initiatives are locally initiated, culturally appropriate, and are based on Inuit societal values and tradition. We believe community members know what their communities need. The hardest work is being done now by our elders, informing counselors, informal counselors, mentors, and leaders. They are the ones who lead language and cultural camps, Inuktitut preschool activities for youth and parenting programs. Above all, with the summit and other initiatives, we are reaching out to those people who are in the justice system, who are facing abuse or dropped out of school. We are listening. Nunavut want intergenerational healing circles, men's groups, and youth groups in their communities. Our way forward is based on cooperation, collaboration, and rooted in the knowledge that Inuit health is holistic in approach. Without doubt, we are faced with a challenge, but also an opportunity to remind ourselves and others of the resilience of the people of the Arctic and the strength of others, and the strength of Arctic solutions based on the cooperation between Arctic regions and its people. Our future requires collective action. We are all in this together. Thank you. Atausalmik inusalmik inuhatigita.
Monika Koyanak. And the next speaker is Gert Mulvad. Please welcome.
President, the organizers of the Arctic Circle, thank you for bringing the circle to Nuuk. For the organizers of this forum, thank you for bringing this item, mental health and well-being, on the agenda. Local capacity with people, family, and local community can strengthen health and mental well-being in the Arctic. A few words about myself due to this presentation. I'm working in the U-Arctic thematic network with health and well-being, member of ICC's Circumpolar Inuit Health Committee, working at the Greenland Center of Health at the University of Greenland, sitting in the board of Greenland Institute of Natural Resources, and especially for 25 years have been a part of the municipality board of family welfare, where we give together with school and social system get advice in cases of child abuse and child mistreated to the politician. As mentioned in the other presentation, health indicators for indigenous people are the indicators we see here in Greenland are the same as we see in all indigenous people all over the world. Then infant mortality, life expectancy, infectious diseases, high suicide rate, substance abuse cause significant health problems, cardiovascular diseases, diabetes and cancer increase, domestic violence, etc. If we have to look at that problem, there are some keywords which we have to work with. Capacity building in the north, training in community, cultural connection, and rapid transition. When we are seeing the list of the problems with indigenous people, we have to focus on some important things when we are looking at that. Indigenous people define and understand the circumstance surrounding their life in terms of multifactorial process rather than taking problem-specific approach, which we often do in the Western health system. You cannot get or demand a cultural, competent healthcare system from the government in South. The only way is to build it yourself. If we are looking at some of the cultural values and compare between indigenous and Western way of looking at it, harmony with nature, domination of nature, soul and body united, soul and body are divided, feeling are important, feeling must be rationalized, education from elders, education from professionals, leaders serve the people, people serve the leaders. To be is more than to have is more than to be. To see it in another way, to look at health promotion and health prevention, how we try to solve a lot of problems in our society is try to prevent, focus on risk to identify, diminish or eliminate risk, focus on the result, focus on expertise, focus on survival, passive participation, do what I tell you, one-way communication, top-down. If we are looking at in a health promotion strategy, focus on resources, mobilizing resources, focus on the process, focus on advice, focusing on life quality, active participation, two-way communication, and bottom-up strategy. Here's a picture from the General Assembly of ICC in Inuvik and the representative of Inuit Circumpolar Council Health Committee with representation from all the 4 Arctic Inuit countries. From the ICC health strategy, I have headline family values and the health and wellness of children and youth are the priorities. Individuals must take responsibility for their own health. Family must take responsibility for ensuring the health and wellness of their children, and communities must take ownership over responses to emerging crises and rely less on external support. Health promotion strategy is important to fulfill this goal. To focus on the family perspective. The family has always been the basis for the childhood. It is necessary to maintain the family perspective in a community in transition. Priority needs to be given over the next decade to ensuring that children grow up in families and the community services are available for childcare, development, and training. Here's my family. We have good and bad experience as all other families. Some in the pictures are dead, but still living in our heart. We have the capacity in our family to take the responsibility for solving the problems for our family members, and we try to take this responsibility. One important thing for family is food, a bed to sleep in, and a work for the parents. Going from to the society, but not leaving the family. For all families in Greenland, the self-government, recognizing that the people of Greenland is a people according to international law with the right of self-determination, own language, common responsibility, solidarity, and equality. That's important for all families in Greenland. To see it in another way, health promotion, cultural and personal feelings, self-definition of health and good life, feeling capable of taking care of own life, identified resources and way of action. The goal is mobilizing energy to handle everyday life and stress situation. Process is needed in some key area. Infrastructure, self-determination of health service, access to a network of community-controlled primary healthcare service. Education has been mentioned many times, but education on all levels is important. Greenland Center for Health Research at the University in Greenland are preparing PhD courses where 50 PhD students during 4 courses the last 5 years have been with research communication, health society and environment in relation to large-scale industrial projects, research method and epidemiology in small population, ethics in small population. We have also planned a master courses. and health education of health professional is also important to get a cultural-based health system. And the medical doctors here in Greenland, we need 100 medical doctors, and here you can see we have 32 medical students from Greenland at the university in Denmark, and 26 physicians have training contracts. And I will sum up with the last thing, family health responsibility, resilience, capacity building through Arctic research and education and through governance. Mining and infrastructure and fishing is important to give the possibility for family to have work. Family values and a place to live and work, capacity for own responsibility is important. Thank you.
Thank you, Gert. And now, Paul Mathiasson. Welcome.
Hi, where is the... Thank you. It's good to have the pointer. Mr. President, ministers, fellow participants and fellow, participants in this conference. It's an honor to be here today. Listening to the speakers before me, I realized that we are all thinking in pretty similar terms, and I'm quite encouraged by hearing what I heard. So I was asked to share my thoughts on health and mental well-being in the Arctic, and as I started preparing for the lecture, I repeatedly, an old patient of mine came up in my mind. And I think the reason that person came to mind repeatedly is the challenges that she was facing, which in many ways are typical for the challenges people in the Arctic face. So I would like to tell you her story briefly to begin with. More than 20 years ago, I was working first as a general doctor in a rural hospital in northern Iceland, and then as a junior doctor at the psychiatric department in Landspítali in Reykjavik. In both roles, I came across a middle-aged lady that I remember quite well. Let's see if this works. Yeah. She was a farmer in a remote valley. She lived alone on a farm in a valley where once there had been a number of farms, but now she was the only farmer left in the valley. She was a widow. She'd been married, but her husband had died more than 10 years previously. They'd had one child, a son, but a few years before he had, in his late teens, committed suicide while he was away from the farm working. From that day on, around the anniversary of her son's passing, she became depressed and bedbound for 1 or 2 months every year, and in the end always had to be admitted to hospital in Reykjavik, 500 kilometers south. I remember that apart from the sad repetitivity, if you like, or regularity of her admissions, the logistics of getting help to her when she lived 160 kilometers from the nearest town, and then the logistics of bringing her all the way to Reykjavik, were quite a challenge. And I remember finding it strange and that there didn't seem to be any way of preventing this happening again and again, of supporting her at home or of mending her problems. Now, the tale of this lady highlights, in my belief, a number of issues that are at least as relevant now as they were 20 years ago, issues that we are struggling with all over the Arctic, although some of the issues are particularly challenging, I believe, in indigenous communities. So this woman suffered from a mental illness, depression, but the underlying reason for her problems was the tragic suicide of a young man. And there is no denying the fact that suicides, especially youth suicides, are a major epidemic in Arctic regions. Now, I use the word epidemic here, both because suicides are so common, and in many, but particularly in indigenous communities, but also because this is a relatively recent thing which has grown exponentially. If we look at Greenland until the 1960s, suicides were rare events in traditional communities. And it's not entirely clear what's happened since, and it's certainly not possible to put a finger on one or two causes, but the transition from traditional societies to modern time have obviously proved very difficult for many communities, and this is known in other parts of the world as well. Now, as early as 1985, Watton was reporting in Canada's north around 60 suicides per 100,000 population per year in indigenous populations, compared to 13.5 in the Canadian population as a whole, so there's more than a fourfold higher risk in those communities. And there a rate of 295 per 100,000 in 15 to 24-year-old men was reported in some areas. Although huge variations exist, the overall picture has not really improved much. In the 1990s, suicide rates of 500 per 100 suicides per 100,000 per year were reported by Bjerregaard in parts of Greenland. What can explain this? Now, the reasons mentioned in the literature are the ones you know about: poverty, childhood separation and loss, accessibility to firearms, alcohol abuse and dependence, a history of personal and familial health problems, and both past sexual and physical abuse. But behind all of this, there is this story of people who have, within a very brief period, 50 years or less, lost a traditional way of living. It's a story of disrupted communities, of families falling apart, and of young generations struggling to find purpose. It is also a story of unemployment, particularly youth unemployment, which is toxic for any community. And looking into individual cases, we're faced with a massive mountain of undiagnosed, untreated, and unmet social and mental health needs. Wherever we look, we see the same pattern, although reports differ somewhat. But large pockets in Greenland, in Canada, in Alaska, in Siberia, all the same high, although variable suicide rate, the same youthful pattern. And it is a major issue, as you all are aware of. Simple explanations do not suffice. The problem must be dealt with. Now, a second issue that the story I started with brings up is the issue of logistics, for lack of a better word. The challenge of trying to bring support to someone who lives in a remote area far away from professional help. Such a person is less likely to have mental health and social needs noticed, and hence less likely to have those needs met, because nobody knows about them. This is something we see in remote areas of Iceland, and there is no reason to believe it's any different in other parts of the Arctic. On the contrary. Certain mental health problems, for sure, are less common in rural areas, but other problems are more common, and people in remote areas are far less likely to receive help and support all over the world. Help that could improve their lives and sometimes save them. So how can we as communities address these issues, provide support and help in areas where we are facing great distances and limited resources? Telemedicine is certainly one way. Evidence shows that assessments and therapy sessions delivered via remote telemeetings equipment is as useful as if delivered face-to-face. So there is certainly much help in this, and the technology is becoming easier to use all the time. I wouldn't overemphasize the use of this technology, however. Such sessions are helpful to diagnose and manage well-known mental health problems, but they do not substitute social and mental health support locally. What is truly needed in the long run is to build up mental health expertise. Technology can certainly help, make better use of resources, but it cannot replace good organization and adequate resources, no more than a fax machine would have done put on a desk 30 years ago. So coming back to the story I started with, the lady I told you about before, she had to move away from the farm in the end. The reason wasn't just her mental illness, it was a combination of things, a part of the long-term trend that sees populations move from rural to urban settings. But would we deal differently with her problems today? Well, we'd probably use telecommunications more effectively, Skype or some equivalent, to monitor her better and support her. But apart from that, I'm not sure really that we're much closer to managing her problems now than 20 years ago. It's a major challenge to think towards the future. How can we properly understand the issues and challenges faced by remote communities, build up communication and collaboration, use new technology intellectually and intelligently, both to help clinical staff, but also to bring together widely scattered centers of knowledge all around the Arctic? I'd like to bring up Bo Kunberg's report from 2014 on Nordic collaboration in health. It's an excellent and a very intelligent report, and from it the Arctic region as a whole can draw many lessons on how to collaborate on major issues. I don't have time to go through the list of proposals. Its recommendations, some of them are highlighted there. All of them are highly relevant within the Arctic region and as a whole, and I think we should look towards learning from it. Now, this is a photograph showing smiley sticks. It's an initiative staff and patients of mental health services in Iceland started a few years ago. The woman in the middle there, hiding behind the smiley stick, is Ásta Ragnheiður Jóhannesdóttir, then head of parliament. The initiative was about smiling in the face of stigma and adversity and collecting funds to improve conditions for patients on our wards. It was hugely successful, not only in collecting money. No, the main benefits were to open the dialogue and sense of community this work brought to those who were involved was hugely important. And that brings me back, towards the end, to the question, how can we start addressing the challenges mental health issues in the Arctic face? One of the biggest problems is being alone with the problem. The individual is often terribly isolated with sadness and loss. So how can we reach out to that person? I think the foundation of that support, as has been mentioned here in talks before, the foundation has to be in the local community, even if it's just a tiny village. There, we will need to train people locally, not only health workers, but also people who can act as anchors, rocks in the society, and the way to reach them is through, well, all sort of different means. Awareness campaigns, etc., in an effort to lift the stigma of mental health problems and addiction, but ways that I, as a health professional, cannot see really or vision are useful as well, because we need to build up resilience and knowledge in the local communities to a far greater extent than currently is done, and use language that is not only the language of health professionals. But on a larger scale, we also need to train far more health professionals, psychiatrists, psychologists, social workers, mental health nurses, all of who can then use health information technology and regular visits to communicate with, train and support local staff. We at the National Hospital in Reykjavik have been willing to accept students for training from Greenland and take seriously our role as an important source of knowledge and professionals in the region. But it's also obvious to me, coming to this Arctic Circle Forum, that strength lies in numbers and in communication. The Arctic region is a vast and very sparsely populated area. It's not just individuals and families that are alone with challenge and stigma. It's also small villages, small towns, and small countries. Addressing these issues on a regional level, leveraging the ideas and resources of the whole Arctic region is needed to tackle these issues. Mental health problems, addiction problems, lack of roles, suicides, and we have no choice but to work together. So thank you very much.
Thank you, Paul. And now you are welcome to have any question to the four speakers. I will ask you to be very concrete and brief with your questions.
Thank you. Kathy Tautungi, President of Nunaata Incorporation. The prevailing authority that exists in the Inuit mind with regards to education, what we now see is classroom education. But in the Inuit societies, education was the total cosmology of the moon, the universe in which we inhabit. My question is to the doctors. Excellent presentation, by the way. We have, as indigenous Inuit, we have seen a lot of physical medicine, pills. With depression and mental illness, has there been any thought to a mental environment when somebody is in a mental depression? Inuit would call it tangnik, the healing of the soul, by surrounding that individual with nature, the sea if they want to, the snow, or also surrounding it with loved ones when they have that mental health. Is there a study, instead of physical medication, of treating the mental health with the individual's knowledge of the total university in which they inhabit? Thank you.
Thank you for the question. Well, I think it would be a very narrow view to regard the epidemic of suicides as simply due to mental illness. Certainly, if you are depressed, severely depressed, or have certain other major illnesses, you're more likely to commit suicide, and particularly if addiction is added. But when you see an epidemic, it's a more profound thing. It's a societal thing. It's more like what Emile Durkheim was writing about in the late 19th century, about kind of social anomie, kind of a disconnection from society. And I think we cannot heal that with any pills. I think the approach suggested by some of my fellow speakers, for example, the Canadian one and also the Gert, the doctor here, is more helpful. As to studies, I'm not aware of any studies directly that look into this, but we do know that promoting self-help, if you like, promoting the individual and the community to take responsibility for one's well-being does help. It gives better long-term results. So in that way, I would certainly say that a suggestion like the one you mentioned would be helpful.
I agree with that. Medication is good if the cause is depression, but is a cause that your mental wellness is not that good. You have to find the way by yourself, by your family. As I mentioned, the family is a very important way to get the capacity for living and having a mental wellness. And it is very important that we as health system, as governance, are aware of that the solution have to be taken where people are living. It cannot be solved from the outside, but here, as I mentioned, the promotion, the capacity building in every area where people are living is important, and not to look at who is responsible for taking care of the problem, but who is living in the small society. For example, the leader of the factory, the school leader, the grandmother, etc. It's here we can make the capacity building. We cannot solve it with social workers which living in the town and not living in the settlements. So the capacity building with the people who live at local places is very important.
Ja, tässä madunguniarparuani oqallinnermi ilaatigunaggueqatitta I would like to speak Greenlandic, so you need tas madunguniarparuannaggueqatitta kultuuri annertuumi nukittorsaatitut oqajartuutigingaat улла ааммараатиуми эққарсаатиссииссут тусарнаарпара илаатсигуаама соқутигинарторуйуссууоқ тассанераатиуми эққарсаатиссиисук оқариартуутингаа уллаа меэқартангу қанга уааертуник илаатигу ерсисаарнеқартарсимаппут сиунертаралугу меэққат инерсимасунгоруник аллигуник сиуниссами нукиттунерунissaат уллумиккуагу меэқартангут сунутаманут ерсинартунут ингалассиматинниарлуи икорфартортарпагу илаатигуллу иммаа оқимааттун аққусаақарсинаанеранни иллерсортуааннартарлугит таамаалиллут иммаа аама меэққат илаат татитуссусеқ илаатигут нукиттуум тигунгиттоортарпаат тасса таамаама уагунаалаккерсуисоқарфитсинни массаккут татитуссусеқ қаллунаату рупустхед таанна паасититсиниаф сутингалугу массакку ингерлаппарпут илаатсигут филмеэққат ассигиингиттут аққутингалугит кисианниарма таассума саниатсигут ангайоққаакаамматторлугит оқалоқатингиттарниссаанник меэққаминнут акисуссааффимми тингусиниссаанник кисианни унаан оқариартуутингорсуллугу аама илуму утоққартангу аторлуарнерусаақарпагут соорлу меэққеривинни атуарфинни имаама пулаартиттарлугит илаатсигуам мисигисарсимасаи аторлуарнеқарсинаамата уна массаккут сулеқатингииннеқ илуатиннарторуссуу наггуеқатит акорнанни ассистими тааюутеқарто тасса имминутоқуттарнерм акиуиниарнерм наггуеқатингиит культууреп ассигитторуйуссуувоқ аернарторсиутит ассигитторуйуссууппут таамааммат тааматут оқалоқа канаруна пиккориссаанерит илиниартитсинерисоорт оқалунгиарнин таасакка нериуппасиуниссами илуақутааллуалерумаарт я қой
Thank you very much for a very serious and sobering message. I'm Nils Andreas Massøy with the DNV GL Group headquartered out of Norway. I recognize that you say that there's no single reason or one simple solution behind the challenges you have discussed today, but I would like to ask anybody on the panel to comment to what extent you think the family disintegration and the lack of responsible fathers has had a major impact on what we see. Thank you.
Thank you for that question. It's very difficult to hear you speaking because the speakers are faced towards you and not us, but I think I heard the question about non-responsible fathers. That is, in my view, one of the factors. There's several factors, and there's never really been one study. Of course, you can't ask the person who's committed suicide why he did that. You will never get that answer. But from the young men that I have known, unfortunately, I know a lot of people who have committed suicide. I want the next generation to not know the people that surround them to have known someone that have committed suicide. Our men sometimes are not responsible. Sometimes there are breakups in families, and sometimes they're adopted out when they're young, and they know that even at a young age, some people remember to adulthood, and they remember their parents that have not been responsible for them. So they may be growing up with their adopted parents or foster parents, and they might not have been properly raised. the person responsible for them might not have fed them properly, might not have encouraged them, might not have loved them as much as they should. And sometimes even we hear that they may have been sexually abused, and there is a lot of that because of the residential school system. It's being passed on, and we are hearing more about that. We are trying to do more about that, and that's why we're putting mental health psychologists into each of the communities, and we are working towards having that support from the community to be the mental health worker who is working with the psychologist, because you need the people from the communities to be the ones helping those that are in need. And that is just one aspect of reasons. There are several. You know, you might have a true mental illness, you might have schizophrenia, or you may be bipolar, or there are other reasons. So I would not say that that is just the one underlying problem. There are several, and each need to be addressed separately. But in the end, I think it's the community's resilience and their want to end suicide, and we need to support that holistically. Governments can't do it alone. The communities also need to face up to that challenge, and we want to be there to support them financially. Thank you.
I just want to not directly answer this, but rather expand this a bit, because this is an economic kind of forum. The focus here is more on that, and I think it's entirely appropriate to include that in this topic in such a forum. But I think I was reading the newspaper this morning over breakfast, and the local newspaper, and there was a discussion about unemployment, with nearly 4,000 people unemployed in Greenland, which is a huge percentage. And I noticed that particularly some parts of eastern Greenland have massive unemployment problems. And I do remember that the same community was marred by some suicides earlier this winter. And you know, you cannot totally separate the two. I think fighting unemployment, making sure that there is meaningful work and that communities are focusing on and finding a sustainable way to, if you like, pay for the health system and everything that we need. We cannot totally separate from the whole discussion. And I think, I mean, the focus of this forum and the way to find a way for the Arctic regions to have meaningful activities and a way to support themselves financially is hugely important as well if we are to kind of get through this epidemic.
Ja, tauata toqqaannartumi akiniangilara kisianni уллумиккут ассерсуутигиннарлуну нарпутаама исоқартутсигитиллугу ааммалу сукулуит амингаатаатсигитиллугит илаатсигум писариақарпоқ ингамми соорлу нунақарфеэққарсаатингалуит нунақарфинни илаатсигу илинниарсимангиттуни сулисорпассуақарпугут таамааммат писариақартиппақ уллумиккут тилимитисини аторлуарнеқарниссаа qanoruna ассерсуутигиннарлу тарнимиккуама наппарсимасут кисинниаама аллат аернарторсиутерартут тилисукиатри аторлугу тоққааннартуми уллумиккут нууммут сукиаатарин алланил оқалуқатеқарсиннаасарпут тастаанна пингаарутилеруйуссууво аама аннертусарнеқарниссаа илаатсигу аама пинаверсаартитсуусиннаами аернарторсиутит аннертунерулингиннссаан уллумикку акеқангиттумик уллумиккут уангу нуумми катторсаависуле қатсигиварпу кисиан таассима саниатсигут акеқангиттуми катторсаанер алла ааллартиппарпут анингаасалииффигинеқарпоқ мааннаккуллу коммуникуяллерма ааллартиппоқ аннертусаавигинеқассаллунни синилериатамаат тас имааппоқ аамнунақарфиими кинерусу орниннеқарсинааллутик катторсаанер ампулантиуссоо иннуттаасут илақутаариит ангерларсимаффитсину нагисаққимангиккалуарлуу катторсарнеқарсинааллутик кисианниаама сукулууит ангаласут тааккуаама маанакку ингерлаппут тасса орнингуттарлути сумииффин ассигиингиттунут катторсарнеқартуссаллаама катторсаавингалуги таамаама писариақарпоқ илаатсигут аллат оёрнартумик амингаатингисагу таама амерлатингитиллугит аллат илиусеқарниссақ мааннаккултаанна аама исумақарпунга илуарисимаарнартуус таамаат ингерланерпут.
And that was the final word from Doris. Thank you very much.
Thank you to this very exciting panel. But now we come to the point where what is we lacked yesterday and the day before was time to have some coffee. So we gained some time today, and you have half an hour. Please be back for 10:30.